here today to talk about in utero restoration of hindbrain herniation in fetal with myelomeningocele as part of prenatal regenerative therapy program that we have here at Mayo Clinic. My name is Rodrigo Luano. I'm the chair of maternal fetal medicine division and a director of the fetal surgery at Mayo Clinic in Rochester.
And I'm Edward Ahn. I'm a pediatric neurosurgeon here at Mayo Clinic, Rochester.
The title of this article is In Utero Restoration of Hindbrain Herniation in Fetal Myelomeningocele as part of Prenatal Regenerative Therapy Program at Mayo Clinic. This article is going to be published in April in the Mayo Clinic Proceedings journal. The article is interesting because it speaks about our experience with in utero intervention for spina bifida, that we performed the procedure with open surgery, and then we confirm before the babies were born that the procedure promotes restoration of the chiari malformation. So the hindbrain herniation returned back, the posterior part of the brain returned back to the position that was supposed to. So the article highlights the importance of the in utero intervention for fetuses with spina bifida. In order to have fetal intervention, we need to have a multidisciplinary approach evaluation, but it's very important to have the prenatal diagnosis, the correct, precise prenatal diagnosis. The prenatal diagnosis is usually confirmed or made by ultrasound, a regular screen anatomy scan during second trimester, 18-22 weeks, that all patients should have. And then once we identified, or the provider, physician identifies spina bifida or myelomeningocele, then the patients should be referred to a center that can offer this type of surgery.
The three patients that are highlighted have a condition called myelomeningocele, which is the most severe form of spina bifida, and all of them had defects in the lumbosacral region. And we know that in the past, our experience with patients who have myelomeningocele are usually born with a defect where the skin is open, the muscles are open, and the spinal cord is exposed, and CSF is leaking outside the bottom of the spine. And in traditional modes of treatment, the defect is closed after the babies are born, and we are describing our experience with the prenatal closure of the myelomeningocele. In the past, studies have shown that there's a benefit to a prenatal closure of the myelomeningocele. The reason being is that while the fetus is in utero, in gestation, we think that the constant leaking of CSF and exposure of the spinal cord to the environment has damage to the spinal cord. So the studies have demonstrated that there's an improvement in ambulation with prenatal closure, and also an improvement in effects on the brain. So the important aspect of closing the defect before the babies are born is that they could be protective on effects that are upstream on the brain. So the infants typically will develop a chiari malformation where there's herniation of the hindbrain into the spinal canal if the defect is left untreated during gestation. And what we are demonstrating is that with closure of the defect during the prenatal period, that we have found in all of these infants that the hindbrain goes back up, and within 6 weeks we find that the effect is reversed, and we're confirming with an MRI 6 weeks after the repair that the brain is normalized after our repair.
Yes, as Dr. Anna mentioned, our study has shown that in utero intervention can restore the brain even before the babies are born. So that's the main focus of this study. So we performed the procedure, we opened the uterus and we closed the defect together at around 25 weeks, 23 to 25 weeks. And then 6 weeks later, even before the babies were born, we performed, we fetal MRI, image of the brain, and we could confirm that those the change in the brain have restored. So we have confirmed improvement of the brain's problems even before the babes were born. So, and this for us is a clinical example of regenerative medicine without injecting any stem cells. Just by itself, by performing the procedure, we can have restoration or regrowth of some of the tissues that are not very well developed. So that was the focus of this procedure. And at Mayo Clinic, we have been doing different procedures with intervention with the same principles.
The important long-term effect of this type of intervention has been with the prevention of hydrocephalus. So in the traditional postnatal repair of these defects, about 80% of infants will need treatment for their hydrocephalus, and that is usually placement of a ventriculoperitoneal shunt, which the children have to live with for life. And studies have also shown that the prenatal intervention, prenatal closure, when we think there's a relation to the reversal of the hindbrain herniation, with the prenatal closure, fewer of these infants require any treatment for the hydrocephalus. So many of them do not require any interventions at all. The article also highlights the efforts of a multidisciplinary group. So there are a lot of people that are involved with the assessment, with the treatment, with the management of the mothers and the children after they're born. So the article is a team effort between the two of our departments, but also with anesthesiology, both pediatric and adult anesthesiology, with pediatric neurology, and with neonatal medicine, and also with rehabilitation medicine.
And with the cardiologists too. During the procedures, we have a continuous monitoring of the fetal heart by the cardiologist. Yeah. So the other fact that the study showed, and we have some other studies, that this procedure is safe to the mother, to the babies. Of course, we have some risks, but we working as a group, as Dr. Ann mentioned, is very important because then we can have better results and outcomes. The key point that we have here at Mayo Clinic is that our group works together with different specialties together to provide the best care for the patient. So that's improves even the gestation age and delivery. So far we have seen gestation age, for example, those 3 patients, they deliver at term, which is around 37 weeks, which is perfect with our objectives. There are other institutions provide the same treatment in the United States and also in the world. So what we are doing differently now is that some other rare other places they are doing too, but we are offering this procedure. The next step is to offer, and we are doing this. We are offering less invasive, which is through scopes. So we are introducing 2 or 3 ports, and those patients can have even vaginal delivery. You want to talk a little bit about fetoscopic repair?
Sure. Yeah. One of the challenges with the open approach that was used in these cases is the risk of a premature delivery, which carries with it a number of risks for the infant if they are prematurely delivered. So the challenge for us as a team has been to minimize the impact on the uterus, and so we have been able to successfully repair the defect through inserting scopes through the uterus rather than opening it. So that's an ongoing study that we're performing here at the Mayo Clinic. So in conclusion, we are presenting an article that highlights a number of cases where children with the most severe form of spina bifida with the myelomeningocele that could have potential impact on the brain and development of hydrocephalus were successfully treated with the prenatal closure with in utero repair of the myelomeningocele. And these infants went on to have a full-term delivery, and they showed that even before they were born, we were able to confirm reversal of the hindbrain herniation as a result of the prenatal closure.
Yes, and this is something that we're exploring here in Mayo Clinic. The restoration or the reversal of the problems by the performing the surgery, as a consequence of the surgery, as a principle of regenerative medicine. So this is a clear example, for example, that performing the procedure in utero, we could restore the brain anatomy as much as possible, and then looking very similar to normal babies, or at least to avoid, to prevent hydrocephalus or more complications to the brain. So that's the main conclusion of this study.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.